Hey Taylor, how are you doing today?
I'm doing fine.
Good. My name's Mariah. I'm going to be your nurse. Is it okay if we talk a little bit about your tobacco use?
Yeah, that's fine.
Okay. It's just kind of like a standardized procedure that we do with all of our patients that smoke. Can you maybe tell me how often you smoke?
I'd say every day for sure.
Every day. And about how much per day would you say?
It's hard to say, but maybe like 2 packs a day.
Two?
Yeah.
Okay. Have you always smoked two? Like when did you start smoking?
Oh gosh. I think I started at age 14, 15, and then it's just I started smoking more once I've gotten older, but
Okay.
kind of started at a young age.
Can you maybe tell me why you started or why you tend to smoke?
Well, my friends, like when I was younger, they started smoking because I hung out with like an older crowd, and so I just kind of did it to fit in, and then I like got addicted over time, and it's just been a habit ever since.
Okay.
Yeah.
Do you maybe have any current health conditions that could be related to the tobacco?
Well, I got diagnosed with asthma. I didn't have that when I was younger,
Mm-hmm.
so I'm like kind of short of breath sometimes, and
Right.
sometimes I'm wheezing where I have to use my inhaler, but that's pretty much it, I think.
Okay. All right. Well, we noticed in your chart, all the questions that you answered in your chart, that your tobacco use is a little bit above the safe limits. And it is it okay that I talk to you about how it's affecting your health? Because I'm slightly concerned about that.
Yeah, it's fine.
Okay. Have you ever thought about quitting?
Not really. Maybe like once or twice, but I haven't really ever thought about completely quitting.
And why not, would you say?
Just because I've been doing it for so long, I feel like it'd be so hard, and I'm not really seeing any problems now, so.
Okay. Well, is it okay if I give you a little bit of advice about your health?
Sure.
Okay. Well, it seems to me that you're already experiencing, although they may be small now, some health issues that is related to the tobacco use. Although asthma can seem kind of small now, it can kind of turn into bigger things. A lot of people kind of get emphysema as time goes on, COPD, and then of course something that we are concerned about would be lung cancer that could happen from long-term use of tobacco. Have you ever thought about any of these potential problems?
I've never really thought about lung cancer.
Right.
That just seems so far from now. But,
right.
I guess I just never really thought about it much. It just seems far away, like when you're older, that you get those problems.
And I can understand that too. We get in the mindset of here and now kind of stuff. But it is important for you to know that those things, even though they aren't happening right now, they are still a possibility from the tobacco use. Do you have any maybe concerns about these? Maybe some things that worry you when you hear that these things can happen?
Well, my dad actually died from lung cancer at age 66, so I guess I didn't really ever think that it was probably something that could happen to me. I just thought, bad luck kind of thing. You never really think it would happen to you.
Right.
But I guess that kind of stuck with me, just hearing all those things. And no one wants cancer. It's like the word you never say now.
Definitely. So. I'm so sorry to hear about that. Sorry you had to go through that. And I can see where you could have those concerns and maybe not want to think about that because of that traumatic experience you went through. Do you see any other cons or negative things that can be associated with your smoking?
Well, I have a niece. My brother, he has a little girl, and he doesn't want me around her ever when I'm smoking, just because secondhand smoke, and he wants me to be a role model for her, and me smoking around her isn't the best role model. Right. So I guess that's kind of something that's a problem.
Yeah. Okay. And I guess since we talked about all these negative things, could you tell me, do you have any positive things that are associated with your smoking?
It helps me de-stress after work, because long days you just kind of want to sit back and relax, and it's kind of one of those habits that I've just accumulated. So kind of brushing your teeth, you just do it, out of habit. So I guess it's my normal thing.
Yeah. And do you do it just to do it, or do you do it for a reason, like the smoking?
I think I kind of crave the nicotine in it, and it helps me with anxiety. And kind of calms me down. So,
Could you think of maybe some other like things that could relieve your stress? Do you do any other things other than smoking that?
well, when I was younger, I used to like work out quite a
Mhm.
bit, and I don't know, that was like helpful. Just
Yeah.
like sweat it out, as they
Right.
would say. But trying to think. Sometimes just watching TV. You don't have to
Yeah.
think about anything.
Yeah.
Sit there, watch Grey's Anatomy.
Yes. Exactly. Okay, so since we've, kind of discussed all of these factors with your smoking, could you tell me maybe on a scale from 1 to 10, what would you rate your readiness to stop smoking right now?
For like a 1 being like
You don't,
and then
you're
10.
not ready at all, and then 10, you're absolutely ready.
Honestly, probably like a 3.
Okay. And how confident would you say that you would quit smoking?
Not very confident. I mean, honestly, probably like a 2.
Why is that?
I just feel like it's been so normal now that I'm older. Like I started so young. I feel like I would crave it a lot, and I think not having like smoking as like a getaway, I feel like I would kind of be down on myself. I've like had problems with depression, and I just don't want to fall back into that. Yeah.
Okay. Are there any other things that attributed to your depression maybe that could have caused you to smoke?
Honestly, like my family, I feel like
Yeah.
they like don't want to talk about like my problems with smoking, but like I don't think it's as much of a problem as they're making it.
Right.
But maybe that has something to do with it.
Mm-hmm. Well, it's good that you're open to talk about it.
Yeah.
Okay. Well, if you were ready to cut down, maybe even just a little bit, what are some ways that you could think of that could possibly help you with that?
I mean, kind of like I said earlier, I feel like maybe after work, if I just like went to the gym, because like you only get so many smoke breaks during the day, so like right after work, not going for the cigarette, and maybe like going for like exercise of some kind.
Okay.
Maybe like trying to do something else on smoke breaks. Like I used to like to read quite a bit. Maybe I could, plot a book during lunch or something. I don't know.
If you had to maybe set like a specific goal for like next week, maybe, what would you say would be a good goal for you to obtain that you knew you could achieve?
Well, I haven't seen my niece in a while, so maybe I could like talk to my brother and find time to like spend with her, and that would be like accountable time for me not to smoke, because I won't smoke around her just because I want that trust with my brother. So that could be maybe something I could do. And
then that'd be good because you could spend time with your niece as well.
Yeah.
Okay. Well, that sounds like a great idea. Maybe would you be interested in making a follow-up appointment in the near future?
Yeah, sure.
Okay. What time would be a good time for you?
Maybe like next week, like into the week after I get off work or something.
Sure, definitely. We will go ahead and get that set up for you.
All right, thank you.
Have a good day.